I have dedicated my entire career to the treatment of women's health, specifically to pelvic floor disorders. As a board-certified urogynecologist, that is our focus in training. So many women that reach our office with urinary incontinence or fecal incontinence have been told they simply have to live with it, and that's not true. Those issues can be treated, and they can return to a normal, healthy, active life. That's what makes what I do a privilege and what spurs the passion I have for treating female pelvic health. I'm Dr. Janet Harris-Hicks, board-certified urogynecologist at FirstHealth Urogynecology. My family is originally from Scotland and Robeson County, and FirstHealth of the Carolinas serves 15 counties in the mid-Carolinas. So I saw it as an opportunity to come home and serve family members as well as communities where I had grown up and where I have lots of family roots. In the United States, there are less than 2,000 board-certified female pelvic medicine and reconstructive surgeons. I believe as a female surgeon, I bring a unique perspective to that field. 1 in 4 women in the United States suffer with a pelvic floor disorder. Pelvic floor disorder being defined as unwanted leakage of urine in the form of urinary incontinence, accidental bowel leakage, or pelvic organ prolapse. Millions upon women suffer in silence, mainly because they don't realize that there are solutions for these problems. Yet we exist as urogynecologists because those solutions are present, and women can seek that care. It oftentimes involves pelvic exercises, medications, or even surgery, but the end result is that they are correctable.
The first word that I think of when I think back to my experience in meeting Dr. Harris-Hicks was validation and relief. I had been at that point on a 7-month journey trying to find help after delivering my second baby. I wasn't feeling like myself. I was experiencing pain, and I was getting answers from no one. And I honestly felt kind of helpless, that I was just going to be stuck in this postpartum state and that this was just the lot that I was given. So when I was able to get evaluated, it was so validating to be told, you have a problem, I know what it is, and this is the path that we're gonna start on to get you feeling better. She did a pelvic floor evaluation, and she was able to walk me through the level of prolapse that I was experiencing both in my uterus, bladder, and rectum. And then we talked about going from the least invasive option to the most invasive options for treatment. So of course we started on the least invasive side, which was pelvic floor physical therapy. So I had, I would say, probably 70% of my pain alleviated from doing pelvic floor physical therapy. But I definitely had some of these really intense spots left. So I went back to Dr. Harris-Hicks. Step 2 was some transvaginal injections that were straight into the trigger points of my pelvic floor. Once she did those trigger point injections, for the first time since having my son, who was almost a year, I finally felt like myself again.
It's always an honor for patients to say that we have been instrumental in restoring their activity and their life. We've given them back their life is oftentimes the statement that is made. And that is a privilege, to be able to meet that intimate healthcare need of the female patient and restore their livelihood.